Hello everyone, my name is Ardianti from Universitas Airlangga, Surabaya, Indonesia. Today I will present 6-week summary of MOOC, Cleft and Kelly. I have received lecture from Prof. Munger, Nutrition Therapy, from Dr. Abdulsalam Mohammed, Cleft Nutrition, and from Dr. Seth Gyamfi, Social Care for Persons with Orofacial Cleft. Mothers of a child with orofacial cleft have greater recurrence risk, reach 35 to 45 times than general populations. Causes of cleft related to mother's nutrition and environment like passive smoking and also from household biomass fuels and maternal dietary deficiency, especially folic acid, mother's metabolic syndrome, gestational diabetes. Folic acid is important because its capability in alter the genes needed since periconceptional as much as 400 microgram daily and reach 4,000 microgram daily for women with previous NTD pregnancy. Nutrition is key factor to maternal, newborn, and child health. Malnutrition happens when supply and intake of essential nutrients to the body is imbalanced. The impact of malnutrition during child's first 1,000 days is irreversible, which can lead to short, medium, long-term health problems and economic burden. Problem of feeding associated with cleft, which can cause delayed weight gain and growth, like insufficient suckling and food escape to nose. It may also cause an undeveloped oral muscles, which relate to future tasks like speech. Whether it is breastfeeding or bottle feeding, place the baby in an upright sitting position. You can use Haberman feeder or Mid-Johnson soft bottle. And the babies need to be given balanced diet for bodybuilding, energy giving, protective for children to grow and thrive. Recommended diet following repair surgery. First week, no chew diet. Second week, soft chew diet. And third week, standard diet. Preventing malnutrition can be by practicing food safety and hygiene. About social care is provided to people with disability, adult at risk, orofacial cleft patient, children in need. Services and care that are provided for the patients from the orofacial cleft team are given to keep the patient from harm or to please their needs. The services must according to principles of social care and involving social worker, relatives, nurse, nutritionist, and also occupational therapists. First to do is gather information and then access needs and then manage change and also prepare the budget. So that's all. My resume for 6-week MOOC. Thank you very much for your attention. Stay healthy.